For 7 weeks late last year, you could say Elizabeth Kromm had one job. Figure out how to ask the White House for $1 billion for rural health care in Maryland and do it so smartly, so impressively, that the state actually gets the money.
I've been a part of things in the past where it's a little bit of, there's a game to be played, and we have to figure out how to play it and then how to win it.
As a top official in Maryland's health department, Elizabeth's job is much bigger than this hugely consequential task, but going after this money, it swamped those other duties, consumed her off hours, cut into time with her kids.
I think this weekend they kind of just got the most annoyed. They've been pretty great, but this was a bit much.
This moment required sacrifices. The federal government gave states just 52 days to apply for new rural funding, money that Republicans in Congress set aside last summer, $50 billion, to soften the blow from their health spending cuts.
The big, beautiful bill passed by the House on May 22nd, it is presenting its challenges.
Those cuts would put rural Kansas hospitals in danger of closing.
It could threaten the financial stability of rural hospitals. And
a tight deadline, much faster than usual, and the Trump administration threw in a twist.
If the ideas aren't good, you don't get the money, or at least as much of it. If the ideas are fabulous, you get a ton of money.
It's a competition that pits state against state. And this is some of the only new money from Washington at a time when states are facing cuts to rural health care nearly 3 times as large as the relief fund.
Somebody called this like the Hunger Games. So I only read one book and I watched one movie because I couldn't take it. It was too stressful. I'm hoping it's not that, because what the heck?
For Elizabeth and her counterparts across the country, these unusual and unpredictable conditions have amounted to a stressful sprint to get as much money as they can.
This is really an incredible opportunity for Maryland, right? So it's a way that we can build on the work that we've already been doing to serve rural communities, and we don't want to miss out on that. Anything where we have a chance to do more, we want to do.
Elizabeth is in government because she believes policy can solve vexing problems, and rural healthcare in America is a vexing problem. Too few doctors, more folks uninsured, higher rates of chronic disease, endemic problems with limited resources. Today, we follow Elizabeth and her team as they try to take advantage of this rare chance to make a big investment and maybe change lives. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs.
Great. Well, welcome to Annapolis.
Thank you. Right, this is your hometown.
Yeah, it's funny. So this was the hotel where my senior prom was.
It's a sunny morning in late October. We're at a hotel on the fringes of Maryland's capital city. This isn't some swank upscale place with valet parking and a grand lobby. It's a modest spot where you'd probably find a prom or a corporate meeting, maybe a trade association conference on a budget, which is exactly what brought Elizabeth here.
Jonathan. Oh my gosh, thank you. I don't think so. Are you good? I know I sent the slides late, but...
Elizabeth is about 5'9", with short blonde hair. It fits her vibe, efficient, tidy. Elizabeth is here to talk to the Maryland Rural Health Association, and it's a big day for her. She's about to go public with the state's plan to spend whatever new federal money it gets for rural health. A lot of people here have opinions on that.
Primary care, access to care,
behavioral health professionals,
the workforce,
oral health, dental careers.
Housing disrepair is also a big issue. Access to quality food.
For the people in this room, Elizabeth's plan could have a big impact on the future of their work. There's a good chance their budgets shrink in light of health spending cuts. This new money, it's important.
Good morning. Look at that. All right. So we've got limited time today.
Everyone in the room, Elizabeth, the audience, they all want the same thing. The most money for Maryland as possible. But that is harder than it sounds. Standing before the audience, she lays it all out. how much is on the line, how it works, what it will take to get these new dollars.
All told, we're looking at somewhere between, over the course of 5 years, $500 million and $1 billion coming into Maryland.
But the amount of money going to Maryland or any state will ultimately depend on a few things. Congress came up with a broad list of what's okay. Technology for chronic disease management? Absolutely. Recruiting more doctors and nurses to rural towns? Sure. Administrative costs? Yes, but only a little bit. The White House also has broad discretion to hand out half the pot, $25 billion. Their score takes into account just how rural a state is and whether states are pursuing conservative policy priorities. Elizabeth levels with the crowd at the DoubleTree. The cards are stacked.
We don't have some of the things that other states have in terms of size of the rural population. We don't have frontier hospitals. Several of the scoring components that go into this application, Maryland just isn't competitive for.
Since Elizabeth first saw the application, she's recognized Maryland is at a disadvantage. Primarily, that's because compared with Texas or New Mexico or wherever, Maryland just isn't super rural. At this point in her sprint, day 36, she's got to be honest with folks. The plan still has a few loose ends.
This is probably where I'm guessing, and I say I'm guessing because we are furiously writing and trying to figure out how we're putting all this together right now.
Elizabeth Kromm is not someone who guesses in public, not about something this big. It's only because her deadline is so tight, she's moving so fast, she finds herself in this uncomfortable position, still with details to nail down. The crowd, they're all banking on Elizabeth to pull this off. On some level, the whole state is, whether they know it or not. And odds are decent she'll deliver something. Elizabeth has a track record of finding a way forward, even when it's hard to see. For example, one of her old bosses, Ken Ulman, told me a story that sums it up pretty well.
I would come to the office with some ideas and be like, hey, you think we can get healthy food delivered on a regular basis to those in our community that need it the most? And she'd be like, yeah, probably. Let's figure it out.
They did it. They pulled in help from a grocery chain and truck dealership. People held in the county detention center got job training to prep the meal kits. A dozen years later, that food delivery service they launched, still going strong. Elizabeth is great at policy puzzles, at looking several steps ahead, at staying focused on results. This strategic superpower that she's got, we heard it as we talked with Elizabeth over Zoom.
Hey, totally appreciate this rubric. Makes sense for, 49 states. It does not allow Maryland to be competitive in this application.
Driving around Annapolis.
I'm trying to play through the argument in my head of is this what I should be pressing on?
And it was super clear as she made one of the toughest choices she had to over those 52 days. What policy goal to prioritize?
But I just wanted to reiterate how critical transportation is.
From the start, transportation, really the lack of it, emerged as an urgent need in public listening sessions around the state. Elizabeth has to decide pretty fast whether to tackle transportation head on. Many policy folks believe that a key to improving rural health is figuring out how to somehow connect people to the care.
If you are not able to actually physically get to the care you need, that's a problem. Not everything is accessible by bus lines, right? Not everybody has access to a reliable car.
Elizabeth knew she needed projects Maryland could pull off quickly and successfully. The Trump administration said states that failed to deliver results could lose this federal cash.
We have to be very practical about our approach because we risk dollars being taken away in future years or clawed back that we've already spent.
Elizabeth realized she'd be starting from scratch on all of this. At the same time, she had proposals for other high-need projects. She made the call.
I'm sure there is some sort of creative solution out there, maybe with more time and sort of the ability to seek out other experts and really try to disrupt in that space. Maybe we could have done that. But that was also me no, we have to go.
When we come back, Elizabeth reveals the projects that Maryland did select, and we go to the western part of the state for a look at Maryland's big swing. Welcome back. Elizabeth Kromm is the person inside Maryland's health department in charge of getting the state its share of $50 billion in new federal money for rural health care. She's been racing to identify a list of projects Maryland will prioritize. And in late October, at the DoubleTree where she had her prom,
In this very room, you all look just as lovely as we did.
Elizabeth unveiled her plan.
3 pillars. We're going to grow Maryland's health workforce, ensure world-class health systems for rural Marylanders, and then food is health.
These are broad, squishy labels for the state's 3 priorities. 1, get more people into health jobs. 2, expand ways people can get medical care. 3, feed people more locally grown food.
We're just really going to go big on food right now.
Food may seem like an obvious choice. Eating well can help prevent diabetes or heart disease, conditions that are more common in rural Maryland than the rest of the state. But states can't buy people food with this pot of money. It's not allowed. So what could Maryland spend the money on? The answer? Local farms, and more ways to get what they produce into the kitchens of their neighbors.
I need more Maryland food in Maryland bodies. How am I going to get that? I have a lot of Maryland farmers, right? Maryland food into Maryland bodies, make them healthier in rural areas.
Elizabeth usually is pretty even-keeled, but when she talks about food, her passion bubbles up. That's because she believes addressing people's basic needs can fundamentally improve people's health. And also, her plan is a great complement to what Maryland is already trying to pull off.
We know through significant research over the years that food matters for health. And there are certain things like medically tailored meals, produce prescriptions, medically tailored groceries. There are already other efforts underway of the physical buying of food. So this is where the 2 come together.
Another example of Elizabeth thinking 2 steps ahead, identifying that these federal dollars could increase the chances rural Marylanders get healthy food to eat. One problem the state needs to solve is figuring out how to cut down on food waste. Right now, some of the fruits and vegetables grown by in-state farmers spoils. Another problem, many small towns have few grocery options, what officials call hunger hotspots. To tackle these 2 challenges, Maryland's application calls for something like a mini public works project.
We usually can't spend money on refrigerators, right? Buying certain equipment. Like a traditional health grant isn't going to pay for sort of the agriculture side of production.
Here's the vision. The state wants to build a rural network of freezers, refrigerators, and cold storage trucks and lockers. Cold food keeps longer. They'd also help business owners to stand up new markets, groceries, or pop-ups. Elizabeth and her team identified $88 million in food investments Maryland could make over 5 years. To get a sense of how this may all play out if the money comes through,
We'll swing around to the backside here.
We sent Tradeoffs reporter Melanie Evans to the far west corner of the state, Garrett County, out in the Appalachian Mountains. Melanie visited one of the small Maryland farms at the heart of the state's plans.
I'm at the Lantz family farms in a side-by-side, a kind of mini truck with 2 seats and a cab.
There's about 5,000 peppers in this patch here. It's about a half an acre here.
Levi Lantz is taking me for a tour. His 7-acre farm is right next door to his parents' place.
There's eggplants. There were sweet potatoes up there we harvested.
Maryland wants to see Levi sell more of those peppers and eggplants to his rural neighbors. For that, he needs his farm to make enough money to expand operations. But getting his small farm to turn even a modest profit means Levi has to look for every efficiency and opportunity that he can find. Just one example. We stop at these domed tunnels where he grows flowers, tomatoes, lettuce, cucumbers. These tunnels help Levi expand his business. They let him keep growing into the colder months.
This one had about 700 tomato plants in there.
Whoa!
Yeah, but we tie them up. We do a double string down to each plant. There's really like 1,500 strings that we're going up to in there.
Can I ask, like, when it's like in full tomato bloom, do you just walk in there and it's got to be gorgeous.
It is pretty. I mean, it's a lot of green. I'll say that. It's a lot of work.
You can tell which one of us is the farmer. I'm like, it's got to be so pretty, and it's a lot of work.
Yeah, it is pretty. I mean, there's so many beautiful moments around the farm, but it's definitely trumped by a lot of work.
All this work is starting to pay off, though, in exactly the ways Elizabeth Kromm hopes to scale. This past summer, Levi and other farmers filled food boxes for 400 local hospital patients. He opened 3 farm stands, and he even made enough this year to scale back his full-time job in IT. It's the first time he's ever been able to do that. He drives me over to the old goat barn, which he's converting to hold sinks and freezers so that as much of his harvest can go into people's homes instead of rotting.
We have the refrigeration units on their way. Hopefully they'll get here next week. So yeah, it's moving along. We got to get more concrete poured. So
wait, are you pouring the concrete?
Oh yeah, we've poured all this concrete ourselves here, this whole entire barn.
Wait, when you say we, meaning like you and your wife or your dad?
My dad, my wife, our neighbor helps us out a lot. His wife helps us out on the farm. She works for us a little bit, and then my neighbor helps us out whenever he's able to and such. But yeah, my wife was pregnant and helping us pour this piece of concrete here. I got a picture of her.
Levi's pretty proud of what he's been able to accomplish on his own. But if the state is serious about creating more robust farms, they'll need more than this kind of devotion to pull it off. Not every farmer has neighbors and family, a pregnant wife, willing to pitch in. If more small farmers can do what Levi does, they can combine to fill the bigger orders, like the fresh food boxes for hospitals. More and more, hospitals, insurers, philanthropies, they want to get their hands on farm-grown food.
We are slowly building up the box programs. There's more and more people that say, hey, I have money. We say the easiest thing to do is put together a box.
That's exactly what Maryland wants, more boxes. And the state is gambling its investment of this new rural money could help the whole program take off. Bottom line, by investing in Levi and farmers like him, Maryland is hoping to help people like Bonita Baer.
Hi, Bonita. I'm Melanie. Thanks for having me over.
You're welcome.
Okay.
Bonita lives 1 county over from Levi, in Lonaconing, a town of about 1,000, around 45 minutes east of his farm. She got a box of locally grown produce last summer, subsidized by a grant through one of her son's schools. She's got 4 boys.
3, 8, 11, and 14.
Bonita's main job is raising her kids. It's a lot to keep up with a rambunctious 3-year-old, give some space to a moody teenager.
And a referee for the other 2.
Okay. Bonita puts a lot of thought into feeding her 4 boys on the family's tight budget. She gets some money from WIC and SNAP, 2 national programs that help low-income families buy food. She's also gotten so incredibly good at scouting for deals.
Like right now, in my app, I have my shopping list for the Dollar General, and I have the pumpkin puree, which is 2 for $3, and then their canned green beans is 4 for $4, and then the corn $2. So my total's at $27.55, but I won't get this until Saturday, so I can get the extra $5 off.
Bonita has all the apps. Walmart, Save-A-Lot, Aldi's. She tracks and compares prices so she can pack as much as she can into her closet-sized pantry at the start of each month.
I have the Chef Boyardee beefaroni. That's my one son's favorite. And then I have SpaghettiOs because the kids like SpaghettiOs.
There's also stacks and stacks of canned vegetables.
Sliced carrots, peas, green beans, corn, sweet potatoes. We have 2 cans for each dinner that we have.
Bonita would love to get more fresh veggies on her kids' plates. And her husband's. He was just diagnosed with diabetes. That's why that $5 produce box from her son's school was such a big deal.
Fresh produce is really expensive in the market. Whenever you come home and you get a box like that for $5, you jump all over it.
So here's how Elizabeth sees it. If she can invest some federal money into growing more local agriculture, it will be easier for hospitals and insurers to expand fresh food box programs for families like Bonita's. I ask Bonita, standing in front of her pantry, how often she goes through the food on her shelves.
By the end of the month, this will be all gone.
So how are you thinking that through as you start to see the shelves thin and empty out? Can you tell me what goes through your head in terms of how you're planning?
That's a good question because I don't know how I do it, but I do it. The anxiety gets to me, that's for sure. Because I'm like, oh, I don't know. What's going to be the next step here?
You said the anxiety gets to you.
Well, a bunch of pressure in my chest. I feel like I get anxious and very jittery, and I can't sleep. I can't focus. It's just everything's out of whack.
There are meals, Bonita tells me, when she has to go with less.
Every day my kids eat before I do. And if there isn't enough to stretch it, I'll eat just a small little plate just to get me by.
Can you tell me what that feels like?
Makes me feel horrible.
If Maryland gets this federal money, it could help ease some of the stress that Bonita feels, unsure if she has enough to feed her family each month.
There are a lot of people in Maryland who agree food is essential to health, but there's some who want to see the state put the rural dollars somewhere else. Hospitals. They are expecting a financial blow as patients lose Medicaid insurance under new Republican policies, and Elizabeth heard from them as soon as she unveiled the state's plan.
The big question that I have is, with the deep Medicaid funding cuts for hospitals, how does this plan help?
That's Mark Boucot. He's president of 2 rural hospitals. As a result of the new insurance restrictions set by Congress last summer, hospitals are expecting more unpaid bills. Lost revenue is projected to total up to $12 billion across 40 states. Academics and the industry warn the financial hit could shut down already vulnerable rural hospitals.
I don't see a connection between how this plan is working and what will be done to help solve that problem.
Elizabeth knew this kind of blowback was coming. In Maryland and around the country, hospitals have staked a claim on this fund.
There were a lot of comments in the media where the language was pretty specific that, this was to save rural hospitals. And so there was a perception from the beginning that these were dollars to go directly to hospitals.
But in spite of all the hand-waving from lawmakers and hospitals about this money being for them, the Trump administration opened up the fund more widely.
They were talking about workforce and telemedicine and innovations in care and food and other, there was nothing explicit to say you should be funding hospitals.
In her final days and hours before Maryland submits its application, Elizabeth and her team check and double-check their work, looking for anything that could undermine what they've done.
The other things that I highlighted in yellow, I just needed somebody else to check that what I wrote made sense.
Just do me a favor and check the last page and make sure you're at the page limit.
Oh my God, if that's the thing that kills us.
Finally, the team hits send.
We ready for sign and submit?
We sure are.
At 5:02, we're early.
We're a day early, aren't we?
Yeah. Look at that.
Amazing job, guys. 6 weeks.
And then, nothing. No cheering or anything. The team is exhausted. After she sent in the application, I asked Elizabeth to step back from the minutia and reflect on this 52-day sprint. Even if there was no money, and I know you're not expecting that, but if there was no money, has this been a waste of an exercise, or was there actually something accomplished?
Oh, I actually think it was a really valuable exercise.
Strategic to her core, Elizabeth capitalized on the application to get very clear on how Maryland could be more efficient at meeting basic rural health needs.
So if we think about sort of solving, improving health through food, that's a 2,000 piece puzzle, right? And so in many cases, I feel like we found all the straight edges, and then someone will do a lot of really good work in this corner, and then someone's like working in the middle and gets frustrated and leaves, right? And this process forced us to really put some pieces together in a meaningful way. We actually had a really good way to make progress on this puzzle.
What happens next is in the hands of federal health officials in Washington who will decide what to fund. The money for Maryland farmers, for Bonita, it may not come through. Next week on Tradeoffs, Maryland finally gets its answer, and Elizabeth faces a whole new round of tough choices. I'm Dan Gorenstein. This is Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. This series was reported by Melanie Evans and Dan Gorenstein with help from Jennifer Weingart. The Tradeoffs team is producers Melanie Evans and Julie Wernow, senior producer Leslie Walker, managing editor Ryan Levy, marketing director Catherine Dougal, sound designer Andrew Perella, chief operations officer Colleen Scheck, with help from Kate Seepy, Cedric Wilson, and Haley Lerner. The executive editor is Dan Gorenstein. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Special thanks this week to Melissa Bolliard, Joyce Emmerich, Mark Holmes, Jonathan Kromm, William Lantz, Alan Morgan, Melissa Netting, Bronte Nevins, Sarah Seitz, Jenna Spear, and Teresa Stahl. Thanks also to all our listeners who support our work throughout the year. Join their ranks at tradeoffs.org/donate. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Foundation for Opioid Response Efforts, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoff staff, advisors, or funders.